Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video we're going to talk about how to spot the signs of meningitis. Now this is a very serious topic. Meningitis is actually inflammation of the space around the brain, a layer called the meninges, and it can either be caused by viruses or can be caused by bacteria, for example something called meningococcus. Now bacterial meningitis is a lot more serious than viral meningitis and requires urgent treatment. Sometimes the bacteria that cause meningitis may also cause blood poisoning or septicemia, and that is what gives you the characteristic rash that's associated with it. It's essential that everyone is able to spot the signs of meningitis and the rash that's associated with it, because treatment is so urgent and so important, especially in children. In this video we're going to take you through some of the signs of meningitis first of all, and also some of the signs of the septicemia or blood poisoning. Signs of meningitis in adults include headache, fever, neck stiffness, nausea and vomiting, and sensitivity to bright lights. In children, the signs of meningitis can actually be quite non-specific. They may be generally irritable or miserable. They may also have a temperature. They may be off their feeds or vomiting, or they may just generally be floppy and lethargic. Sometimes they look pale and blotchy, and in rare occasions they can have seizures or fits. It's very difficult to distinguish between bacterial and viral meningitis without doing specific tests that are done in hospital. In meningococcal septicemia or blood poisoning, you may or may not have some of the signs of meningitis, but you may also have things like fever, feeling drowsy or lethargic. Children may go off their feeds or start vomiting. They may feel very cool to touch, particularly in their peripheries. Septicemia may also give you a rash that often starts as a blotchy rash but then moves on to dark red or purple patches. These can start anywhere over the body and spread quite rapidly, and characteristically they do not fade on pressure, and that's the important sign to look out for. Anybody with signs of meningitis or signs of blood poisoning needs urgent medical attention. That's purely because it can be very serious and even can result in death. Vaccination is the best tool we have in preventing meningitis, but even that cannot prevent all the different kinds. If you think you or your child may have been exposed to someone who has meningitis, then please seek medical advice, because you may need treatment as well. And that's how to spot the signs of meningitis.